Young people are also playing a role in the public healthcare system. One of them is Dr. Sivuyile Madikana, who's using social media as a tool to talk health. He's created a health initiative whose target audience is students at institutions of higher learning. And he joins me now. Dr. Madikana, good evening. It's a pleasure to have you on News at Prime tonight. Now, if one is looking for an instant community of young people, it's very easy to find them online. The big thing is exactly how you go about getting their attention. What's your approach been?
Kathy, thank you so much for having me. Now, so what I've managed to do in the past couple of years is managed to grow my social media audience generally in terms of young people that follow me, and it's across the board. And so I decided to start using the social media audience that I've had to put a lot of initiatives in place, because I know young people will tend to listen to people that look like them, that sound like them, and are probably the same age as them. So I think growing my social media audience and you know, as one of the influencers in this space, I've managed to use that influence in terms of healthcare and being able to target the right people, and it's worked out pretty well.
What are some of the issues that you bring up?
So, I mean, mainly my focus in terms of what I talk about on the social media platforms are around health, preventative healthcare, but also mainly a huge focus on using my social media platforms for HIV, and how do we change, you know, our behavior and the behavior of young people around HIV in terms of preventative measures. So how do we get them to understand that you need to ensure that you get tested every 3 months, you need to ensure that over and above the testing, what other preventive measures such as condoms that you can use. So mainly it's been focusing on HIV, but in the past couple of months, as you know, we've been facing the corona pandemic, which has taken the world by literally a global storm. I've held conversations on my social media platforms called COVID-19 Conversations, where I talk to a couple of healthcare professionals in terms of how they deal with COVID-19, and in a way to try and educate people that are in the audience, so that we know that, you know, they can start using masks, and also the importance of washing hands and hand hygiene.
When we take a look at your demographic and the conversations that you're having, the hashtag varsity convos, many of these people you're speaking to are students, the bulk of which would not necessarily be on medical aid. They're probably still relying on their guardians for income to be taken care of. So how do you ensure that they begin to prioritize health, even though they might feel like they don't have the means to necessarily do it in the way that they would like to?
So the same always goes, you know, prevention is better than cure. And I think my aim in talking to a lot of students that are in varsity and younger people is to ensure that they put health at the forefront of everything that they think of. So it's not something they put at the back, and you know, it's only when they've got a problem that they go and seek healthcare. But it's important that they use all the preventative measures that we do have in place in order for them to live a healthier and a better life. You know, there's a program run by one of the big medical aids, which is it talks about, you know, vitality and ensuring that you keep people healthier for longer. So in me talking to young people, especially, they are prone to things like communicable diseases, which are conditions that, you know, can pass on from one individual to the other, so such as HIV and sexually transmitted infections. So what happens in that space is that if you're able to educate them before they get it and ensuring that they prevent themselves from getting it, it reduces the burden of disease in the country as a whole.
Have young people told you about how they've personally been affected by COVID-19? What is their experience during this time?
So, I mean, just across the board, the big conversation is really about, you know, we don't know enough. So they always want to keep abreast. They use social media as much as I can. And I'm laughing because the fact is I feel like I'm also a young person. So I know that I use social media a lot. So the conversations I try to drive on my social media platforms are really about educating people, because information is so vastly available, but not all information is correct. So what can we do as healthcare practitioners to educate more individuals? And mainly what I do is ensuring that I take the information I get from places like the World Health Organization what I learn in interacting in my workplace, and essentially bringing that information and knowledge and then delivering it in a way that is understandable to the youth audience, and in a way that drives conversation, but also healthy conversation as well.
All right, Dr. Madikana, we certainly wish you all of the best in your endeavors. Let's leave it there for tonight, Dr. Madikana. Interesting work that he's getting up to.